Hi, this is Dr. Ajay Kumar and welcome all my viewers to my channel. This is a matter of great pleasure that we are going to discuss a very burning topic of nowadays, that is diabetes, and how homeopathy can help in the cases of diabetes, in its cure and management of diabetes. Uh, Nowadays people usually come with क्वेश्चंस लाइक डॉक्टर साहब मैंने डायबिटीज़ की बहुत सारी एलोपैथिक टैबलेट खाए हैं और मेरे टैबलेट की खुराक बढ़ रही है, क्या होम्योपैथिक में कुछ हो सकता है? एंड मैनी पीपल कम विद डॉक्टर साहब मैं तो प्रतिदिन टहलता हूँ, एक्सरसाइज करता हूँ, खान पान को नियमित रखता हूँ, इसके बाद भी मेरी डायबिटीज़ की प्रॉब्लम बढ़ रही है, कॉन्स्टिपेशन हो गया है, हाइपरटेंशन हो गया है, तो मेरे प्रॉब्लम धीरे धीरे बढ़ रहे हैं, तो क्या होम्योपैथी में इसका इलाज संभव है? एंड यूजुअली वी नोटिस दैट पीपल जनरली कम विथ डायबिटीज एज वेल एज विथ कॉम्प्लिकेशन of diabetes. So only with diabetes the patient usually are very few, and with complications the diabetic cases are very frequent. So dear friends, today we will going to look into the matter, can homeopathy has a potential in diabetes. India has become a very large hub of diabetic patients, and almost every family suffers from this. The incidence of diabetes is rising day by day, and it is a matter of great concern for all the practitioners of medical science to tackle with this problem. I will not go into details of the academic portion of diabetes, about what is diabetes, types and causes of diabetes. I am not going to deal into that, everybody knows, and I will just focus upon can homeopathy play a role in diabetes. So I would begin with a few cases to understand it. Long back, in almost 10 years back, I saw the first case of diabetes, and that was of recent origin. The lady was about 65 years old, and she told me that she has a lot of thirst, and her appetite is also very high, and she is feeling very weak. Her perspiration is very high, and urination is very frequent. So she was suffering from polydipsia, polyuria and polyphagia. So this was the classical symptom of diabetes, and in the family history she had her father diabetic, her many brothers were diabetic, and she has suffered all these symptoms quite recently, since a few days. So when the laboratory checkup was done, it was found that she was diabetic, and among the other symptoms that were noticeable was that the lady was having a lot of gastric issues, constipation alternating with diarrhea, flatulence, and this has been since long. No other symptoms were important for the prescription point of view, so I am not going into details about that. So what was noticeable in this case was the very classical symptoms of diabetes, polyuria, polydipsia and polyphagia, and that was along with great debility. And dear friends, with on this symptom only, along with the gastric history, gastric disturbances, flatulence, I prescribed her uranium nitricum 200. I exactly not remember what doses I gave, but there were only a few doses that were given. I don't think it was more than 2 or 3. And she was checked up in the next month, and the blood test report was negative for diabetes. The follow-up was done for almost 1 year, and there were 3 tests conducted during that period, but neither the symptoms returned nor the lab test ever came positive. So this was a fantastic case, and it was my first encounter with diabetes, and the lady is still free of diabetes. Almost 10 years, over 10 years have lapsed, and she has never gone under diabetes. This was the singular case of diabetic which I cured at that time. So I couldn't understand whether she was really diabetic or whether the lab report were wrong. So there were doubt in me. I cannot say that she was not diabetic. She was diabetic, but because I had the idea that diabetes is incurable, so I began to doubt about those lab tests. And I didn't claim of curing it because there were no addition to such cure in my clinical experiences. But after 10 years, when I saw many of the cases of getting cured in diabetes or getting improved under the homeopathic treatment, so I am now sharing this case that uranium nitricum under those conditions cured that patient very well. Even when the patient had a history of family history of diabetes. So this was a journey which I started with diabetic cases. Later on, I got a case of a 45 years old lady who had been suffering from diabetes since 3 or 4 years, and her problem was she was very sensitive to the allopathic medicine. So usually she dropped allopathic medicine for diabetes, and she said that डॉक्टर साहब जब मैं ये दवा खाती हूँ तो मेरे गैस के प्रॉब्लम बढ़ जाते हैं, मैं खाना नहीं खा पाती हूँ, मेरे जलन बढ़ जाते हैं. सो मैं टहलती हूँ, मैं बहुत टहलती हूँ, 3 किलोमीटर 4 किलोमीटर टहलती हूँ. खान पान को मैं कंट्रोल करती हूँ, और मैं दवा नहीं खाना चाहती हूँ, और मैं दवा कभी कभी भूल भी जाती हूँ. And one important thing in that case was that she said that she was very much aggravated whenever she ate rice. So राइस खाने के बाद उसके प्रॉब्लम काफ़ी बढ़ जाते थे, फ्लैटुलेंस बढ़ जाते थे, देह हाथ में गर्मी बढ़ जाती थी, नोचनी बढ़ जाती थी. So these were the issues that was very peculiar in that case. And the way the lady told the whole history smacked of that she had no problem. वो कहती थी कि डॉक्टर साहब मुझे तो कुछ हुआ नहीं है, बस ये थोड़ी सी प्रॉब्लम है, और तो मुझे कोई बीमारी ही नहीं है, मैं बिल्कुल फिट हूँ, अगर ये ठीक हो जाए तो मुझे तो कोई बीमारी है ही नहीं. सो आप इसको ठीक कीजिए. So this was the tone of the lady, and the lady was very smiling. She talked with laughing, and what I observed that she was trying to control the whole problem by herself, by her walking, by taking caution, and apart from that she was also frivolous because she was not taking medicine regularly, and she was, in spite of having knowledge that rice aggravated her problems, she used to take rice sometimes. And she had also a delusion that she had wealth, because she was telling that she had no issue except that. So, and she was smiling, she was always cheerful in the clinic, and I observed that she was a chubby type of lady and not um, uh, fatty like calcaria, or not ever even or not thin or lean like phosphorus. She was in a middle built lady with a fair complexion, and her face was red, almost plethoric. She had a plethoric face. So her temperament was sanguine, and on this constitution, with the remarkable temperament of mental state, that she had no problem except this little one problem, this singular problem of diabetes. I took only 2 or 3 rubrics. First was delusion wealth of, second was rice aggravation that you find in generality chapter, and she had also history of family history of cancer. So only this, with these 2 rubrics you will get sulfur as a medicine. And she had a temperament of sulfur, she had a constitution of sulfur, her clinical presentation was of sulfur, she was not bothering a lot about it, and she was taking caution as well. She was frivolous in taking, oversensitive to allopathic medicines. All these were clear indicator for sulfur. And as she had no problems, she was 45 years old and there was no problem. This was also indicative of a good health and very less miasmatic complications. So this case was diagnosed as a soric diabetes, and sulfur was given in this case, and LM potency was used, and almost in 3 or 4 months her diabetes level came under normal, and she was followed up for almost 2 years, and her diabetic didn't return. Her treatment was closed, and almost 5 years had lapsed so far, even more than 5 years has lapsed, and she is absolutely free. She is even taking nowadays sweets, and there is no problem. So this was the very happy moment for me to find that homeopathy can do well in such cases. This was not a complicated case. This was a very gentle case of not very long origin, and moreover this didn't have a very strong genetic history. So sulfur in this case cured this patient, and this led to me to understand that the cases which are of recent origin, and those who don't have a miasmatic complexity or hereditary inheritance or hereditary history of hereditary, those cases can be cured with success with homeopathy. So thereafter I started to think on the line to classify the diabetic cases. First, on the miasmatic ground, whether the cases are of singular soric origin or they are of mixed miasmatic origin, and secondly, whether the diabetic is acquired or whether the diabetes is from hereditary acquaintances. So diabetic cases which are of soric origin, or the diabetic cases which has no family history of diabetes, they are much prone to be cured with homeopathy. And those cases which have mixed miasmatic background and have a strong family history, they are less amenable to homeopathic cure. However, in many of the cases I found that even with second group, diabetes in mixed miasmatic with of mixed miasmatic origin, or diabetes with a strong family history, they have a lot of complications, and those complications can be easily managed under homeopathy. So homeopathy has a role in this category also. Another important thing which I noticed in the second group, that their allopathic doses didn't increase. In such cases, I don't suggest the patient to drop their conventional medicines. The medicines which they have been taking, I allow them to continue with them, and I just used to taper the doses of conventional medicines once the homeopathic medicine starts manifesting its results in positive manner on that organism. So this way, homeopathy, according to me, has some important role in homeopathy in the cases of diabetes. I am sharing one case here of complication of diabetes. A person of about 65 years old came with me with history of diabetes, which has been over 25 years, and he is on conventional medicine since long, and he has prostatic enlargement, and he has urinary trouble. Her main problem at this time is that he has retention of urine, and he feels distended bladder. There is fullness in the lower abdomen, that is painful. He goes for urination, but he has to wait for urination, and he has to strain. Even he bends a bit forward to press upon, and he is not satisfied with the urination. Urination is very scanty. It is dribbling type of urination, and he has to go frequently. So he has constipation also. He is very sentimental type of person, and I found that I found his constitution to be of calcarea carp. He was very perspiring and very sentimental, very fearful. Thou he boasts of a strong of being a strong. He boasts of being a strong, but he inside he was not so strong, and constitutionally he was of calcarea carp person. But in this complication, when the manifestation was more centered on the bladder and his urinary trouble, I prescribed him Pereira breva in 30 potencies, and within a few days his urinary problem became much less, and he was almost okay. I can say he was almost okay. And his constipation was also well taken care of by keratin. I don't know how did keratin work, but I gave him keratin, and keratin in titration, and keratin worked very well to take care of his constipation. So I do experience that constipation, urinary trouble, and apart from other ancillary trouble that is associated with diabetes can well be managed by the homeopathic medicine if we prescribe on the homeopathic principle, Hahnemannian principle, which he has taught under organon, that is similia similus curenter, minimum dose, single dose. I do admit here that in most of the cases which I have seen, I have not seen that one single medicine is enough to cure the case. As the treatment progresses, the symptoms changed, and another set of symptoms come up. There are various layers of the diseases which I have found. Once one goes off, another layer comes up, and this way if we treat on a group of symptoms, that is that we call the totality of symptom, homeopathic medicines does very wonderful to remove that layer, and the patient is much better thereafter. So this is a brief presentation, and there is lot of thing to say here. There are lot of cases to say here, but this is just a blinker, a twilight, to show that homeopathy has a role in diabetes, and if we can work upon it, I do believe that a lot many cases of diabetes can be cured, and those who are not incurable, that can well be managed with homeopathy. So dear friends, if you have any query, feel free to question here, do your comment, share this video, like this video, and subscribe my channel. Thank you very much.